Well, let me say that it's an easy collaboration because we share common features, Jordanians and Italians.
Now, if you remember a story about patient, you restore his vision after this development in this retina specialty, you can share. We welcome you, Professor Paolo Lانزيتا from Italy. We welcome you in this international retina meeting in Amman, and we want you to share your experience about your participation in this conference.
Let me say it's a great pleasure to be part of the faculty of the Amman Retina meeting organized by a very good friend, Dr. Fazal Fayyad. This is a top-level meeting in the Mediterranean area, and it's a great pleasure to be in the meeting and in Amman and in Jordan. Beautiful country I love. I had the honor to give some talks and a keynote lecture which was based on a kind of a patient journey through the last 30 years, patients with wet AMD and how treatment changes modify the course of the disease. I'm old enough, unfortunately, to have gone through all the treatment advancements over 3 decades. So starting from the very past, we had very few treatment possibilities 30 years ago, namely laser photocoagulation, which was a destructive therapy. Unfortunately, most of lesions could not be treated because of the foveal location, and those lesions which we could treat with laser photocoagulation, unfortunately, did recur at high frequency, more than 50% of the cases. And more than that, patients were gradually and continuously losing vision because of the expansion of the lesion and the scars created by the laser. After that, we started with a newer therapy more than 20 years ago. We had great hopes in photodynamic therapy by using a drug, verteporfin, plus light activation with a laser light.
Yes, yeah, really interesting insights, Doctor. I wanted to ask you about, from your perspective, you're now in Amman and you're exchanging medical knowledge and experience.
I have to go to the final part of this development. Let me finish very briefly. Unfortunately, photodynamic therapy was not the good choice because we could only limit the loss of vision in our patients, but we could not improve and restore vision. Luckily enough, in the last 15, 20 years of experience, we had access to newer pharma therapies, namely anti-VEGF, which are being injected intravitreally. And with the advent of anti-VEGF therapies, we can really restore and improve vision in our patients. And in many countries, the frequency of legal blindness in those patients has decreased by at least 50% or over. So today's therapy, and we've been discussing this quite extensively in this great meeting, is anti-VEGF therapy with the newer drugs.
Yes, okay.
Very great success. Good luck. Yeah.
Yeah, that's actually very interesting. I'm sorry to interrupt you, Doctor.
No problem. But I had to come to this modern era.
Actually, it's very interesting that you're talking about advanced medications. How can Jordan and Italy or Europe collaborate together in order to study this medication more on patients?
Well, let me say that it's an easy collaboration because we share common features, Jordanians and Italians. All of us are living in a big common area, which is the Mediterranean area, common origins, common habits and use. So there is a strong friendship in between Italian ophthalmologists and Jordanian ophthalmologists, and we share experiences continuously. So it's a good start. And then when we meet each other at different meetings, international meetings, what we see is that our approach to patients is usually the same one, our treatment choices are the same ones, and this facilitates everything.
Now, if you remember a story about patient, you restore his vision after this development in this retina specialty, you can share.
Well, I've gone through different eras and different treatment possibilities, and I can for sure say that patients being treated with the newer therapies, the intravitreal treatments with anti-VEGF, do show they are definitely very grateful because they not only can maintain their vision, but in many cases they can improve the vision, and this means a lot in daily life. For example, this means keeping your driving license, having the possibility to keep reading the newspaper, meeting friends, recognizing friends. So this makes a big difference, and this is true in Italy, in Europe, in the Middle East region, and in Jordan.
Yes. Thank you so much, Dr. Paolo, for this interview. I hope you enjoy your stay in Amman.
My pleasure. Yes, sure.
Thank you so much for your time.